Hi, I'm Dr. Karen Alexander, Principal Investigator for the Preventable Trial and a geriatric cardiologist at Duke University in Durham, North Carolina. I want to tell you a little bit about the Preventable Study. For years, researchers have been working on ways to prevent dementia without a lot of success. Some studies suggest taking a statin might help, but we don't really know. A statin is a commonly used drug to prevent heart attacks by lowering cholesterol and keeping our blood vessels healthy. Preventable will be one of the largest research studies for adults 75 years of age or older. It will test whether taking a statin can help older adults live well for longer by preventing new dementia, new disability, and heart disease. Approximately 20,000 participants without heart disease or dementia will be randomly assigned to a statin or a placebo. A placebo looks like the statin pill but doesn't have medicine in it. We then plan to follow participants for up to 5 years to test their memory, their thinking, their physical abilities, and follow them for future events such as heart attacks or strokes. Preventable is very important to older adults because for the most part, people 75 years or older without heart disease were left out of clinical research studies testing statins. However, about 1 in 3, or about 30% of older adults without heart disease are still taking statins. Preventable is an opportunity to understand if that makes sense. If people who don't have heart disease still benefit from taking a statin after age 75. Many people know one more pill may not be desired. Preventable is a pragmatic trial. Pragmatic trials use newer, simpler methods to connect researchers with participants. They allow participants to complete study assessments easily, at home, and on their own time. In Preventable, we plan to follow participants by reviewing their health records, by making phone calls or home visits, and we even plan to mail study drug directly to them at their home, preventing their need to come back for future study visits to the clinic. Pragmatic trials also try to answer practical questions. They focus more on understanding if a drug has a desired effect than on proving how a drug works. We already know a lot about statins, but the results of Preventable will help us understand if taking a statin is helpful for older adults after the age of 75. For more information, please visit our website. Thank you very much for taking the time to listen today.